We just whispered to each other. We didn't know each other. I said we would like to know. Some things we do very far, maybe sometimes spend too much on it. I thought it was great. Anybody else?
A good way to get acquainted with each other, and plus coming up with kind of the idea of how educating about and reaching out and just that kind of that speaker's bureau idea from it, which seems like a good idea. Yeah. So that's put that on the positive column.
Oh, yeah.
Yeah.
But we did some of people saying she be able to follow up and put it.
No. No. Now, we have other things to do. At least I think.
Hi, Emma.
Hi.
Got your long coat on today.
Well, I'm trying to be prepared in case it rains.
Oh, gosh.
Yeah. Pencils for it.
Yeah. Yes.
Hi, Kim.
Oh, hey, Alyssa.
Sorry, I just found out at the last minute I have to participate remotely.
I understand. I always love your background. You like outer space.
Yeah,
That's the Milky Way galaxy, supposedly.
Oh, yeah. Supposedly. Who took that picture?
I got it from NASA.
Oh, I know, but the idea that someone is outside of the Milky Way taking a picture
How are you?
is bad.
I know, right? That's why I say supposedly.
Probably some satellite floating around.
We're gonna wait a couple more minutes. I haven't heard from Laura, as the vice chair. I don't want to get things going. I'm assuming she's gonna be here. Joe, you said we're really close to a quorum, right?
Well, yeah, I think the members intend advisors. Well, so we have four people in person and then 2 people. Zoom.
Yeah, Virginia said it was okay, more than I thought it was, and I'm gonna trust her if she knows those kind of things. So that,
They can vote if they're not in person.
yeah. Sometime, Sean, you're gonna get one of these all to yourself. You know you've arrived when you have your own tent. She's drinking that, Mr. Burnett.
It's something delicious. It's looking at it. It's really good.
It must be good for you then.
Yeah,
Drink.
it's a cinnamon horchata.
Horchata.
I highly recommend it.
Oh.
If you don't,
When I was in Fairbanks,
I just-
University of Alaska, a professor was there and he was from England and he said, I can't understand how you have so many choices. Well, that was about 30 years ago. Hey, Laura.
Breakfast there.
Yes, I'm
Yeah.
sorry, I was gonna sit.
Hey, Madeline.
Yes.
We were holding the meeting until you got here, Nell.
267-9726. I'll be by there at 1:30, I bet you'll let me. I'll be by there at 1:30. 267-9726.
No, not at all.
It is a lunch hour meeting.
Well, good, that means that he's up and about.
Right, it is Thursday, March 28 at 12:17. I am Laura Montagna and the Behavioral Health Board meeting to order. Oh, no, I don't have my notes.
I'm in a meeting till like 1:20. We all.
Can you do roll call, Joe? Please.
Alyssa Norman,
Kind of present.
Laura Montano,
Here.
Natalie Arroyo,
Here.
Jimmy Bass, excuse, Tim Doty,
Here.
Debbie Hartridge,
Here.
Annette Kellerman,
Here.
Vernon Price,
Here.
Liz McGowan, Catherine Smith.
Present via Zoom. Yeah, that's it.
I'm here, just on Zoom.
I hear you, Kat.
So is that, do we have a quorum?
We do.
Awesome, all right. Guests in the room. Starting with you, Sean Berger.
Sean Berger, community member and parent advocate.
You're not a guest.
Feels like it.
Bob Doherty, I'm here for Nation's Finest Veteran.
Back in the corner.
David Hackenbaum, member of the HCTC Advocacy Board.
Going to, I'm just totally blowing this. Guests online from the public. We're going backwards.
You're doing fine, Laura.
Hi, Marguerite.
Oh. Lots of waves. Rebecca.
Hi, I'm Rebecca Graves. I'm the community health manager for Cloxotto for Nevada, the 8 milligram naloxone. I'm just kind of seeing what's going on with you guys and wanted to introduce to just let you guys know that I'm out here if anyone has any questions or anything like that.
Say again, what organization you're from?
I work with HICMA. They're the manufacturers of Cloxotto 8 milligrams. We've been getting a lot of inquiries from counties in Nevada about a longer acting naloxone. And so I've just been reaching out. I've talked to NIE and the PACE coalitions, just trying to see how I can best support anyone if they have any questions or need anything. I'm just kind of trying to see what's going on because of all the questions.
Thank you. All right, staff, starting with you, Paul.
Hi, Paul Bugnacky, Deputy Director of Behavioral Health.
Hi, Emmy Boxler Rogers, Behavioral Health Director. No, mine.
Jack Brazil, Deputy Director for Behavioral Health.
Hi, I'm Alex Childers. I use they them pronouns. I'm a peer coach at the Transition Division.
Laurel Johnson, I'm an analyst in DHHS admin.
Danette Kellerman, social worker with Humboldt Public Council.
Online staff that is here.
Sharon Wolf, legislative analyst with DHHS. Hi.
Hi, everyone. Sonia Levy Boyd. I use she, her pronouns. I supervise the Humboldt County Transition Age Youth Collaboration and the peer coaches at the Transition Age Youth Division.
Is there anybody else out there? All right.
Can I ask a process question?
Maybe.
Is it possible to get the volume a little louder on the remote participants?
Working on it.
Gotcha.
Are there any adjustments to the agenda? Hearing none, we will move ahead to public comments. Yes.
Hi. So again, I'm Alex Childers, I'm a peer coach of the Transition Youth Division. I got two things. One, the Humboldt County Transition Youth Collaboration is turning 16 years old, becoming K-age, which is very exciting. So we're inviting all community members to attend our Sweet 16 celebration from 3 to 5 p.m. on April 15th. It's a Monday at the Labor Temple. And then my second thing is I looked over the bylaws, and in a previous meeting of this board, I heard that there was going to be a seat on the board for a veteran and this seat for a transition age youth. So when I looked at the bylaws, I saw that a seat for veteran was in the bylaws, but I didn't see that a seat was set aside for transitioning young person. So I was just curious about why that was. I think it'd be really cool to put that in the bylaws in addition to having that veteran seat written in. I think it'd be a great way to demonstrate commitment to engagement. And I also think it'd be a great way to ensure that youth expertise and lived experience is part of making decisions that impact behavioral health services that serve us young people. Thank you.
Thank you. Online, is there any public comment online?
Marguerite.
I'm not sure.
You need to unmute.
Or chat us something?
Maybe she didn't have a comment.
I thought it was my mind.
We can't hear you, Marguerite. If you can chat, great. If not, we'll come back, maybe can rejoin. Oh, there she is. Yay.
Okay, I think it's Eric who wants to talk.
Hi, I've been basically cruising the neighborhoods around here trying to figure out how to improve the outreach program for mental health. I think that people on the streets generally have a bad opinion of mental health, and especially because their connection with mental health is usually through law enforcement or 5150. And so they tell their friends and talk about it and whatnot, don't deal with mental health. And here we are doing all this work trying to improve the program, but our outreach program is basically unworkable. I'm hoping that we can get a program where people reach out to the community members and tell them about what's available. I have absolutely no problem with the way mental health in general is being run. It's a terrific program. I've been through it myself, and I like all the people I meet at mental health. The problem is getting people to mental health, and I would say the ratio of those who need help and those who don't, or those who get help, is probably like 50 to 1, 50 to 1. And it would benefit greatly for the people in the community and basically out on the streets to gain some understanding of what we're doing with mental health and what programs they have to offer. So basically that's my thing. I'm all about outreach. I do it myself all the time. And it's just a matter of getting people into the door at mental health and letting the magic happen. Okay, thank you.
New tagline. Yes, Marguerite?
Hi, so I have two small items. One is that in my efforts to get to know Humboldt County again, I've been invited to go to a sort of provider get-together meeting that happens every 2 months. There was supposed to be one in March, but it was canceled, so I'll be going to that in May. And that'll help me get more on board, which is great. The other thing is that, and I'll talk about it more at the SUD time, but I did go with Oscar of the board to the Aegis Clinic last month and had a real good tour and an understanding of what they're doing. They see 450 people a day, which is impressive. And, you know, I think they're going to be going both to this meeting when they can, and then they've already started to participate on the SUD committee, which is great. Thank you.
Thank you. Any other public comments? Hearing none. We'll go to action items. Anybody want to make a motion to approve the minutes?
So moved.
Debbie and Tim. Forget the words today. All in favor of approving the minutes as submitted?
Right.
Jeanette, are you approving them?
I approve,
Thanks.
even though I wasn't here last month, so I don't know what was actually said.
Okay. Any abstentions or noes? The minutes are approved. Now, I'd like to see if someone has a motion to send the bylaws that are forever the bane of my existence to the Board of Soups for final approval.
I'd like to move that we approve the bylaws as presented.
Second.
Okay, so we have that motion now. Is there any discussion?
I do.
Discussion?
So based on what this young lady just said about Tay not being in there, I think that should be added before then.
So did you read through that? Because we had legal go through it and follow what was Welfare Institution Code. And they just added the veterans thing. No, I didn't check. Yes, please.
Not being an expert in procedure of these types of things, but I'm thinking that the idea of having Tay representation on the board perhaps could be achieved some way besides putting it into the bylaws. Just a thought.
So since Emmy went back with them to legal, I'd like her to comment on that.
So I'll just say my thoughts about it and your board can decide however you want to proceed. So Tay has always been a priority to the Behavioral Health Board, and we've had individuals serving on this board, and I know the board has worked very hard to outreach and include Tay. The language in the bylaws right now is strictly based on what the code requires, and so that's what's included in there. So I want to acknowledge that it doesn't mean we couldn't add language around Tay, that's the board's preference. That could certainly be added. And I would also say that your board can decide, given the effort you put into prioritizing Tay as a seat on your board, you can decide if you want to do that now or if you want to add that in the future. And I think either way is fine. And I recognize that these have been waiting for a super long time to get approved. And I recognize that having Tay at the Behavioral Health Board table is super critical, and demonstrating your commitment to that is also important. So.
Good job.
Tim, thank you.
The board pursued this for a long time. We had subcommittees meet with the Tay group, and they brought us many proposals for adjusting the structure and the process of the board. And in examining those, we worked hard. I know Alyssa and Tim Ash did, and we had meetings here, and felt like that some of those requests were not capable because they weren't legal for the structure of us, because we're a deliberative body and not a discussion group. Now, as to the membership, I agree. Laura, Tim Ash, and others have worked so hard to get a paid person on. And in the past, I remember we had them and they were great addition to us. So we can still have paid members on the board. And so that's where we came out, was to encourage that. I remember the discussion saying, if we're not legally required, then that might leave a space open because we can't find someone. And so that we thought might be at certain time more inhibiting than enabling or empowering us to do that. Kind of struggling for words. But I want to say we worked really hard. We want that. So let's get that Tay people on and we'll see how that goes.
Debbie,
Do we have an opening on the board
do we?
now? Yeah,
Yes.
one or two or what?
Right now, later in this meeting, we are going to be submitting 3 names.
Right.
We have one other one, and I believe there will be one position after
So there'll
that.
be an open position.
I believe so.
Okay, so we could decide here that in this moment of time, we would like to prioritize searching for a K person to be on the board for that open position without putting it in the bylaws. I'm wondering, thinking aloud.
Natalie.
So I have some thoughts on this, but I did miss the board portion of the board retreat where you talked about the bylaws. And so I apologize for not being able to be there for that portion. My thoughts are, and I'm, I think I'll be, if this ends up being discussed by our board, I'll need to be able to articulate, what the recommendation was. And that said, I think our board, the Board of Supervisors, has been very supportive of TAY. And we recognize that in the future, because of Prop 1 and changes stemming from that, we may see changes in TAY and we want to continue to support them. But I think codifying things like a role for TAY in this organization would be good if there's a legal way to do that. And now I know you've had a lot of discussion around that. And I don't know what the attorneys came away with, but I know that for like the Juvenile Justice and Delinquency Prevention Commission, now that's formed for a really specific purpose, but it requires that there be youth on that commission. And so I think there are mechanisms for that. And so I'm wondering what the attorneys thought of designating that. Was there specific feedback that was not able to be done?
I can just speak to that.
Okay.
There wasn't, like I said, I think that what the intention was to make sure anything that was required was included. But certainly if there are other desires of the board, those could be written in too. And to my mind, it could be written as, I hear worry that if we say it has to be this and we can't find it, then it's problematic. I think it could also be written as, it is the intention of the board to, fill at least one position with the TAY if at all possible, like something like that, that would also, I think, express commitment, but not bind obligation. But I don't think there's anything prohibiting adding language around it.
Okay, well, I will just say from my perspective, I'd love to see that added because I think that'll make it clear that that's the intention longer term. But I like the idea of making it such that that it would prohibit that seat from being filled.
I think one of the questions might be, there will likely need to be some changes to the bylaws in the not so distant future, partly because of Prop 1 passing and other things. And so I think it's up to this board. I agree. I think there's real value in adding that intention of the board. And maybe the question is that something that you all would want to have happen before getting approved today? Or is it something that you would want to have as an amendment in the future and approve them as they are today? Those are the two questions about it. Yeah.
I'll call, Vernon.
No way.
So as a person who's been on this board for 2.5-ish years, and there were never approved bylaws since I've been on this board. I have worked quite hard to try to invite TAY. I've gone to JJDCP meetings and tried to find TAY to join the board. Oscar was TAY, and now he's too old, or he's just aged out of TAY by 1 year. We do in the bylaws have a committee that is devoted to TAY, so I would just implore you all to consider approving these bylaws, and we can make any amendment y'all want once these ones are approved. Vernon, you had something?
I know we'll get stoned for this, but I back Supervisor Royal. Well, I just don't want to be the agitator of the waters, but my concern is making them feel making TAY feel welcome. And I think that needs to be in the bylaw. Now, I'm also like this, how how soon can we do that? How, with expediency? Is there, what's the possibility of getting that done today? And there's no possibility.
No.
So,
If they have been submitted,
mhm.
approved, went to legal, came back with changes, submitted to us again, we need to approve them, and they don't have to go, if they're approved as is, they don't go anywhere, right, except to Board of Supers. Then at our next meeting, we could start discussing on how we want to amend them, we certainly can do that. We have a subcommittee devoted to TAY. So I have been searching for someone to be on this board from TAY. So wait, I think you had your hand up next, Annette?
I just, after hearing, the comments, I think that I would second it. To go ahead and do it, and then we can just start discussing the changes afterwards.
To approve the bylaw?
Yes, I'm sorry.
We had a first and second, right?
Yeah, the first.
Okay, and then Natalie, and then thank you.
So we, at our board meetings, we have council there, and can make small wording changes or in the moment, or sometimes we have items brought forward that have, this is the recommendation with this possible amendment. So just thinking out loud here, even though it hasn't gone to legal, the recommendation, because we'll have that next step in the process before it gets adopted, my thought is that it could come from this board as these are bylaws that we've been working on, and this was a one-line amendment that we'd like to recommend. And then before it gets on our agenda, they could either incorporate that, or it could come to us for discussion about whether to incorporate that. So that could offer that other layer without having to go kind of back through the whole process. If this board wants to do it that way or feels comfortable with that, it's a little bit outside what they would probably normally do, but if they're mad, I'll fall on my sword for that.
Well, I don't feel comfortable with it.
Okay, fair enough.
That's me, but.
Fair enough.
So Alex, you had a comment?
So, I was just gonna say, I had no idea it's been 2 years that the bylaws have been under review. I'm still pretty new to the youth advocacy board, and I understand that this has been a very contentious issue in the past. I personally really like the idea of amending the bylaws once we get them approved, just so that we can keep moving forward. And I just show good faith, because I know we all are very good-hearted people and doing great. So, yeah, just thought I'd put that on.
I think there's somebody on.
Melissa, Sharon.
Hi. Hi, this is Sharon. I just want to say when SB 326 passed, which then became Proposition 1, which was passed by the voters, that bill included changes to the Behavioral Health Board structure. Also the scope a little bit. So those aren't implemented as of yet, but those are coming. And I wanted you to be aware of that because, of course, you know, the board can do whatever it wants to do, but you might want to approve the bylaws that you've been working hard on at this point because you know for a fact you are going to be revisiting the bylaws and there's going to be some additional changes. So you don't have to worry too much about avoiding it. It is going to be changed. And more information will be coming out as the state evaluates everything. But I just wanted to let you know that that is coming.
Thank you.
So Sharon, and I was gonna bring this up, when we decided that we needed to put a veteran on, we put that in there, and then legal counsel gave us the wording according to the you know, and so let me read it. We shall notify the County Veterans Service Office about vacancies on the board. At least one member, behavioral health board, shall be a veteran or veteran advocate. A veteran advocate means either parent, spouse, or adult child of a veteran or an individual who is part of a veterans organization, including the Veterans of Foreign Wars, or the American Legion. Part of me would want such accurate wording on it. And I know that one of the discussions we've had is, what is a TAE? Is it someone who's not involved with behavioral health, mental health, or is it someone who's 20 years old and has had nothing to participate with? This one says this defines what that. And so I would like to see that in, so that's more clearly what we're approving. And so I guess what I would like to do is to go back, I don't know if this is piggybacking on yours, Natalie, but we could approve for us to move ahead as a board without voting on a specific wording of it. For me, as a parliamentarian, I don't want to vote on something that isn't clearly written down. If we want to vote on let's proceed to do this, I'm in favor of that. But if the wording is not clear, either for the legal counsel or for what we're gonna do, then it might be very confusing and problematic. I don't know if this makes sense, but I would support this, and we're going to have to support it, but I just want the wording to be clarified.
Tim, if I could build on that, you're absolutely right. There is specific wording in the legislation that was passed, and I'd be happy to send that out to be shared with the group if you'd like. But the problem is then the departments, all the various departments involved in laws, has to define what that means further. So you're right, we need some clarity, we need some guidance on exactly what they mean. But the bill that was passed does give you a good overview on exactly what their intents are and what they're looking for. Which, as I said, I'd be happy to send that out if you would like, but we are going to be waiting for more information as the state figures out the language, the definitions, and all the pesky details.
Thank you. So, any more discussion? I would like to call for the vote. And saying that we are gonna have to amend these sometime next.
Are we voting as is with a plan to amend, or are we just?
We're
stopping the
voting as is. We all know we can amend the bylaws at any time.
Okay.
Can and will.
Can and will and must, correct. Any more discussion? Tim?
No, I hope we're all okay with this, that we're moving in the right direction on this. That's all.
So my thought is that this should be a roll call vote. Joe, can you do that? So we'll call for the vote. Which is just,
Alyssa Norman?
well, she can't vote. Online? No, she can't.
I think she can, right?
Virginia
It
said
has-
it. Okay.
No, so to have a roll call vote by somebody online, you have to be in a secure location where the only person there, and you have to do it ahead of time.
Okay.
Yeah,
Okay, so Laura Montana,
yes.
Natalie Arroyo,
Yes.
Tim Doty,
Yes.
Debbie Hartridge,
Yes.
Danette Kellerman,
Yes.
Vernon Price,
Yes.
All right. So with that, the bylaws have been approved. And will be amended, and Tay people, thank you for your kindness. I'm always trying to find somebody. All right. Next on our action items is, I realize we have to do these each separately, approval to send membership application for Bob Doherty to the Board of Supers for approval.
I'll just, that's the motion. I second it. I wouldn't do this right.
Well, I think that I'm not supposed to make any motions, so.
You make the motion
You make the
first. I
motion?
make the motion first.
Okay.
Would someone second that motion?
Second.
Okay, just
All right.
discussion. This is Bob. We're talking about, we're so glad that you're here. I think Alyssa, Laura, and myself met with Bob at our second office at Ramones and had a wonderful conversation. And Bob comes with lots and lots of experience, and is the veteran with a whole lots of connection with that. So I just urge us, that we vote for him to be, approved to be a member.
Would you like to say anything, Bob?
I'm honored to be here.
Thank you. Any other discussion? Call for the vote. All in favor of submitting Bob Doherty's membership application to the Board of Soups, please say aye.
I,
Aye.
Aye. Opposed? Stand aside. Awesome. Yay, we're sending you off to the BOS. Sorry, I'm sorry, I'm giddy. I'm just-
Oh, I get it. Not more than me.
Approval to send membership application for Sean Berger to the Board of Soups for approval.
I would move that we approve to send membership application for Sean Berger to the Board of Supervisors for approval.
Definitely. Did you second? Were you the second?
yeah.
Sounds like a second.
All right. Do you want to say anything, Tim? You did such a great.
Better say something.
Oh, yeah.
Introduce everybody.
I was on them all. Sean brings, again, lots of experience, both as a consumer, as a family member, but in probation and some other areas. And that's something that we need on the board, that kind of experience. And I think we're all had a wonderful conversation with Sean. I think you'd be a great asset to us. That's my statement about it.
Would you like to say anything, Sean?
Just that I look forward to serving this board and getting involved with all the things that we do.
Awesome. So with that, we will take the vote. All in favor? Aye. Opposed? I believe that's a pass, but we will be sending Sean Berger off to the BOS.
I'd like to move that we approve to send a membership application for Marguerite Story Baker to the Board of Supervisors for approval. How did I do, Emmy?
Great. Yeah, great job.
Second. Jumping ahead.
And the second, awesome. Marguerite, would you like to say anything?
No, I'm really looking forward to being back on the board. I was there 3-4 years ago for a full term, and my experience is largely, though I have had some experience in mental health, it's in substance use disorders. And of course, that's half of what the Behavioral Health Board is about. So I'm real glad to give that voice.
And I want to thank you for your patience, Marguerite. I think I thought we had sent you off to Board of Soups long ago, and I appreciate your patience and for all the work you've done so far in the SUD Dual Recovery Committee. So thank you. So with that, another discussion, we'll call for the vote. All in favor of sending Margaret Story Baker to the Board of Soups, please say say aye. Aye. Any opposed?
Welcome to all three
Three
of
for
you.
three. And there's more coming up. More to look forward to. So thank you all for being here. Whew, communications. This is the time for us board members to share all the things that are cool and awesome that we've been up to and that we want to share with the group. So I'm going to start with you, Mr. Doty.
I said last time that we need to keep humbly aware of the complexity of what we're doing in our department, the added things that are going on, and perhaps at our retreat, talked about the Board of Soups, painful decisions coming forward in terms of a decrease of 28%. Is that?
Oh, less than 20
Okay,
in fiscal year 26-27,
so,
but still.
Funding or people?
Funding, and I can talk about it in my
Okay.
update.
okay,
How do you clarify?
there's so much coming down. I guess what I want to add to that, I think kindness and support is the plan for us to keep working. That's it.
Yeah, I'll just say, NAMI Humboldt continues to offer our family support groups weekly. We have one on Monday, one on Thursday in Eureka, and one in Garberville, Redwood area. So we continue with those groups. We also have been starting up, I think it's tabling season, and we did some tabling at Pine Hill School with lots of information about mental health issues. And there, apparently, I wasn't there, but I heard that we had many people come over and be interested. So this is something that we can do to reach out to the public about mental health, what our services are here, what, just some basic information about issues like schizophrenia. We have a pamphlet on numerous different mental health issues. So anyhow, Laura, you're working on the May's Mental Health Month stuff, and you'll probably talk about that. So I'll just leave you to that. But I know that NAMI Humboldt is also helping financially support some of the activities that are going to be presented in May this year. So that's NAMI.
Thanks. What's up, Natalie?
Well, I'll touch on the budget thing in a minute. I wanted to highlight a couple other things first. So I had the opportunity to be part of a town hall with Senator McGuire this week, Tuesday. That was 2 days ago, yep, this week. And he invited me to be part of this panel. So myself and Mayor Kim Burgell were both there answering questions and giving a short update about the county and the city respectively. Kim got a chance to talk about a lot of the city's really innovative programs aimed at, serving community members, including folks in crisis, and some of the efforts the city is making to really just have a more comprehensive approach to serving those citizens. So a lot of what Laura knows in and out. Excuse me. I got a chance to talk about some of the DHHS-led projects, some of which Senator McGuire has helped secure funding for, around the Mental Health Residential Center and the Triage Center in Arcata, the Navigation Center coming down the line, and some of the work that has been done with the HOP funding stream. And Connie was gracious enough to provide me some highlights that were really succinct that I could speak to there. And so that was of the questions that came in. So the senator got more than 200 RSVPs. So those were just the people who RSVP'd for the event. And of those, the questions that were submitted, the top issues were homelessness and mental and behavioral health. So that was really on the minds of people who RSVP'd. So, he touched on some of that as well. I'm also going to the County Supervisors Association of California Legislative Conference in 2 weeks. So I'll be there attending and going to, I have my choice of which policy committees to go to learn about upcoming legislation. And so because I serve on this board, I'll definitely spend some time in the Health and Human Services space learning about what legislation is coming this year. I know we have an awesome team of people who work on that as well, including the legislative analyst who's here today. But I'll be doing my part to learn about that, and that's a great space to connect with other, county officials to advocate. And so if there are any highlights you want me to kind of dig into there, I'm happy to do that, maybe especially if staff have any thoughts about like what's coming down that I should be paying special attention to. And then Tim, since you brought it up, I will touch on our budget so it's clear, kind of what this will affect. So going into this coming budget year, which it is budget time for the county, all of our departments are being asked to prepare budgets to present to the board in the coming weeks. And DHHS has a much smaller share of the general fund than many other departments, but not no amount of general fund. And so this year we're expecting an additional general fund allocation of between $15 and $18 million, which has happened in years past, and we do still have a fund balance to carry forward. to address those additional general fund requests. And then if things continue going as they are and those same projections apply next year, with department budgets essentially otherwise staying the same with these additional general fund requests on top, we'd be looking at essentially a smaller pot that we can backfill with next year, and then in fiscal year 26-27, a budget shortfall. So that is all projected, and it's based on some kind of commonly agreed upon parameters in the county administrative officer's office. But that said, you know, we're projecting right now about an 18.75% shortfall for general fund funded departments. So we're having conversations now with people about that, which are kind of terrifying them, and asking everyone to just be really like kind and collaborative as we go through this. There is a tendency, of course, for everyone to look out for their own department, and we are looking for like agency-wide opportunities to reduce costs and to increase efficiencies and to cut back where we can this year and next year so that we don't have as rough a time in 26-27 and moving forward. So a number of contributing factors have led us here. Some of it was having budgeted previously for Measure S revenue from cannabis, which then the board at the time chose to suspend those taxes, and so we're hurting from that, having been in the budget for last year and not materializing. So we're working to adopt as best we can, and it's going to hit a lot of departments like the sheriff's office, probation, DA, a lot of departments pretty heavily. So I'll just say that I don't envision cutting back much in the realm of what we all talk about here. At least, what Prop 1 looks like is to be determined. But when it comes to the general fund expenditures, I'm not aware of a huge impact on the work that we're doing, but it'll trickle into all kinds of other aspects of what we do as a county. So it's not great news. I will say when I first got on the Eureka City Council, we had a 10% across the board cut in the first year, and it was not fun to be in the seat when that happened. So I kind of find myself here again, and it's something that, the state isn't really going to have the coffers to help us with too much either. So we're going to have to find ways to deal with it. So Tim, since you brought it up, I wanted you to know it's not 28%.
Okay, I'm
At
glad.
least there's that.
I am corrected. I
It's
stand
only
corrected.
19.
Thank you very much for sharing all that.
So anyway, anytime folks have questions about that, and if we want to have kind of a larger discussion here about some of the implications of that, and what we expect to see, especially as we go through between April and June, we'll be having budget presentations and then public conversations about what strategies for reorganization or efficiency we might be able to implement. And department heads are all part of those conversations right now. So it's not like we're trying to hide things from the community. We just want to have those internal conversations first and make sure that when we have those publicly, we have a good sense of what direction we're going in.
So in the executive committee, we try to plan ahead for presentations.
Yeah.
And so I'm wondering, you don't have to commit yourself to anything, that July might be a possible time for you to come to the Behavioral Health Board and just kind of say what you say, here's where we are.
July or August, maybe, then we'll have a better handle, and that
We
would
don't
be good.
meet in August because everybody's gone on vacation.
Perfect. Well, definitely summer or early fall. Yeah.
All right.
Good for you, Connie.
We'll talk on that some more, but it seems like it'd be a good thing for us.
Yeah, and I'm sure there will be a million headlines, and I'm kind of cringing already about the public perception issue that, I don't know, that we've been poorly managing our resources or something like that. And I know that because DHHS also has a big budget and people don't understand always funding streams and stuff, that, there will also be some, finger pointing and stuff. And so I ask you to all just kind of, participate in the conversation as best we can as we're talking about what changes to make. And, change is really hard for people, and change on this scale is going to be hard for the county. So here we all are.
Thank you. Yeah, thank you for that uplifting.
I think
Uplifting.
one thing that we could add to Natalie's conversation though is that, and sorry, Connie, that Human Services Director, I'm super late because I was having a crisis call in my car. But I just think that it's an opportunity to say AOT is something that we will be putting in for a supplemental budget because it hasn't been budgeted for future years. And so that will be a supplemental budget as part of our budget process. So yeah.
Thanks. Jeanette, do you have anything?
I really don't have much. I can say though that I appreciate the patience since I've been out on surgery and of me not being here. And also anyone that wants to be a part of the Recovery Happens picnic planning will be starting next month. So if you have my number, please, or my email, please email me and let me know so we can make sure you're either on the Zoom or no. I don't think we're gonna be meeting in person yet. So we can send you a Zoom link to help participate.
Awesome.
Do you have the dates for picnic yet?
I think it's gonna be the third weekend of September. Because lots of people have lots of stuff going on the first and second week, so we're trying to.
Okay, thanks. My announcements are May is Mental Health Month. We're having an event on May 4th. 4th be with you at the Warfinger. It is City of Eureka. It's the Mayor's Mental Health Initiative along with NAMI, along with some DHHS and Cal Poly.
I think they're kicking things.
And you should be seeing more information about that. The keynote speaker is Joe Roberts, known as Skid Row CEO. He spoke at CIT International Conference and he was a very compelling speaker. He's coming from Canada, so that's going to be exciting. We'll have a professional panel and a lived experience panel. So it's going to be a good day and I expect you all to come and bring your friends. Also, we had a great retreat. People that were there, it was great to have that and I really appreciate Emmy being there and sharing. It was awesome. And I think the only other thing, working with Vernon to be able to have some print collateral to go table. This is tabling season and we're going to get some of that in place so that you can table on behalf of the Behavioral Health Board.
I won't have to do it, I can't do it by myself because we don't have a driver's license or vehicle. But
and on to you, Vernon.
I have sent a proposal into Director Beck via email. I'm hoping that it is professional enough done. I know it may not be as professional as you're used to, but please bear with me. This is a desire of my heart to see the Behavioral Health Board engage in the community and tabling an event. Because there's a lot of people out there that does not know about the Humboldt County Behavioral Health Board that may need to. So just getting out the community engagement is really what I would really like to see. So thank you.
Marguerite.
Yes, yes.
Would you like to let us know about, oh no, sorry, that's later.
Okay.
Pause, never mind, rewind. Item 7, discussion items, behavioral health board retreat outcomes.
Did we hear from Kat and Alyssa about communications?
I'm sorry.
No, that's okay. We're partners.
Alyssa, do you have anything to report?
No.
Okay, love that background, thank you. Catherine Smith, do you have anything to report?
Just that we are gonna try and get our committee to meet soon for the Semper Virens visit. And try and get that scheduled as soon as we can. I know we kind of had a little bit of a lull after the holidays, but it's March now, and so we're gonna try and get back on that ball. But other than that, nothing to report.
Thank you, Kat. All right, thanks, Tim, for keeping me on track. Now we can talk about the behavioral health board retreat outcomes. Since you were in charge of putting that on.
I thought, first of all, I want to thank everybody who came and spent the time there. I often am kind of beating the drum for building up community and relationships, to be able to talk about issues that sometimes are hard, but to know each other, where you're coming from. I just think is important, and I thought it was great. At the end of it, we talked about goal setting, and Alyssa wrote down about 36. Alyssa, do you remember how many goals you wrote down?
I was just looking for the notes.
It was a lot.
It was a lot. So I kind of felt like we had a general goal with a lot of specifics on that. And I want you to correct me and we can go on that. That the general goal is, as a board, we wanted to, for the next year, try to focus on ways to engage the public, so they know what we're doing and we can reach out to them, and do a better job of that. Communications, whatever it is, that was the goal. Is that what the rest of you remember?
Education, educating our community.
Educating our community.
Yep. We have lots of services and people say they don't know how to find them, and we have them in certain places, but it can be overwhelming. So I think, yes.
Can I just throw in too, I know that, I think it's PHHS is working on a couple of new brochures that are having to do with services and there's one that has sort of a map, and I don't know who's seen it here.
Yeah, Laurel brought those to us.
Well then, I mean, I think that's really gonna be a nice brochure to use for that purpose that you're talking about. And it's not quite done, but as far as I know, right, Laurel, it's getting there. The brochure with the map of access to services.
Those are all posted online and
Are
good
they?
and done. Yes.
They're done, okay,
Yes.
great,
Yes.
yeah. Good to know.
And I can share some succinct information to Joe to share again, and for some people it'll be a repeat, and for some people it'll be great and new.
Can we make copies? Excuse me, I'm sorry. Can we make, keep trying to turn my head, sorry. Can we make copies and hand them out in the community?
Well, we got a folder that had a bunch of copies. There's a wonderful page where you can click on all the links to go to the information. There's a lot. There's also a card that has a QR code. You scan, it takes you to that.
So a lot of our people that are in the community are not very computer savvy or telephone savvy. And I get to be in the community quite often doing all kinds of weird stuff. Not weird stuff, but I feel like I'm everywhere doing all kinds of stuff. And so like if I could get permission, I don't know if it's possible to just make a copy of them and then hand them to people.
Sure, there's a lot of things.
Okay.
There are a lot of things. So Laurel, can you? Yes.
Danette, I think that was part of the reason we did some of this stuff
Okay,
online is we know not everyone's online, but we wanted to support the supporters. This was to
Yeah.
support the assisters, the volunteers, the social workers, the folks in churches out to be able to disseminate information further. So that's why we made it available partly for the interested individual, but partly for the people who are helping share the information that's available, but sometimes hard to see. So that was part of the intent.
the thing that caught my attention is the mapping thing, because I think that a lot of our clients would get, would hold on to it because it has a mapping, you know, for mental health.
And the idea
I don't know how to
was to
explain
make
it,
some of it,
visual.
accessible both to the end user who's the individual seeking services and the end user who's the person assisting somebody. So yeah, it was meant to be accessible, and we can talk offline about if you need support in getting some printed copies. But it's, yes, it was made available for you to print for a reason.
Okay, thank you.
So I want to say what Vernon has proposed and is working on is right up front what I think we want to do. And that is engaging with the community and bringing information. And so for us to think through, to support that, and it's almost like we need 20 brochures or whatever it is, and people come to a tabling event and you can say, well, what are you doing for children? Or what are you doing for the homeless? You can say, here it is. Well, how do I connect with this? Here it is. And it seems to me that you're right on target for us to do a major engagement. And one of the things I like about it is it's a real engagement with the public. And often also we need something more for consumers.
Well, I know that at least in the last year, at least 20 times I've had people come to my door where I work, the office door, and ask for a resource list. And so, so something more simplified.
And you have the resource cards? You
I
have
do.
them? Okay.
Yeah, yeah. I probably could use some more.
I bet she's gonna go get you some
You're
right
right.
now.
I see your hand, Natalie.
I'm just curious if at the retreat, if you, thanks, Laura. Thanks, you guys. If you talked about some of the goals of where you'd like to do the outreach, or is that to be determined?
I think we talked about partnering with people, like partnering with NAMI when they know where to go table.
Okay. Because I was just asked if I had ideas for Friday Night Market for organizations. Now that is, you don't have to do every single market because they're every week for like 4 months. But I personally could not commit to doing every Friday for 4 months. But I do a couple, and if there's interest in that, I can follow up with the organizers and help get that scheduled, but no pressure.
Answer her question if I may. The names or types of event, now I'm reading from the proposal. May is Mental Health Matters Month, Suicide Awareness Walk, Recovery Happens, St. Vincent de Paul Block Party, Town Hall meetings, etc., along with the
Friday Night Market?
Friday Night Market.
Okay, great. Well, I'd be happy to, would you all like me to just contact, sorry, but just to wrap this up, would you like me to contact the person and ask if we can have a couple dates for Friday Night Market?
Yeah.
I would love that.
Okay, I will commit.
Maybe we could team up with NAMI.
Yeah, we were invited, well, anyone is invited to table it. I have 2 events that just kind of came up too. They're both races. One is up in Prairie Creek Park and one is down at their Redwoods relay race. They have tabling down there. So I'm trying to get people to do that, and maybe Vernon, I can email to you and see if you wanted
I would love that.
to do one of those tablings, because NAMI we have a certain small group of people who will do things, and we need more people, basically. So combining forces sounds good too. Another thing that I thought came out of the retreat was the idea of perhaps doing a speakers bureau type thing where we have people who are ready to go to talk to groups, which NAMI sometimes do. We get invited to talk to groups about like school groups, church groups, service clubs, etc., about just mental health issues and NAMI. And there is a demand for that, I guess is my point. So I can see the behavioral health board maybe coming up with some kind of presentation that would be like half an hour talk that we could give to different groups and just get out there in the community and help people find services and just know more about we're your neighbors and we're interested in mental health issues and we have experience with that and just kind of destigmatize the whole issue. So
Virginia and I were kind of interested in the speakers for general group. And again, back to the packet of information. Say, if I go to Kiwanis or whatever kind of meeting as a representative from the behavioral health board to engage with information, again, it'd be nice to have the whole kind of packet of things that would go to, a tabling thing, but will also go to a speaker's thing. This sense of so many people in the community don't have a clue and don't know how to connect. So that's what I heard us saying. So that's why I go back to the packet idea. And I know who's good at putting together packets. I'm not.
Can I just say one thing about that, which is we store stuff, NAMI stores stuff here, we're happy to have space to store some of our educational materials. And if anybody wants to hang out for a minute or two afterward the meeting, I can show you, I can give you some of the brochures that we have about different issues. And I have to get Michelle to give me the key to that room so I can get in there. Okay, if you want to, let me show you. We have about 6 or 8 or 10 different educational brochures we use.
Thank you. I think Alyssa's got something to say.
Yeah, I sent the notes from the special meeting to Joe, and I'm running into difficulties finding the notes because I took them on my laptop and I no longer have access to that laptop. So the only copy of them is with Joe at this point.
All right.
Sorry about that.
I know.
That's okay.
Thanks. All right.
I want to say, this is our goal for the year. We don't need to get it done in a week or two. We just need to keep working on it so that at the end of the year, we can say, what do you do with this one more? Look at what we got done.
Yep. Good retreat. We should have more of them. Yes.
I did bring in some documents printed for her. Michelle, the receptionist, is available after this meeting for behavioral health board members who need some copies printed. Some of you guys are at agencies and you can definitely print your own, but if that's a need that you have, Michelle is going to be ready for those requests. A couple of the things I'm giving her, just so you know, there's the small water resistant cards that don't have a ton of information because we're limited on space, but they're great for people who don't have a file cabinet, right? There is a 1-page, 2-sided crisis urgent needs document that does spell out things more, not just mental health or behavioral health, but other immediate crisis needs, shelter, resources for people experiencing homelessness, food pantries, etc., crisis lines on it. That's an available document. I brought copies of the Adult System of Care Roadmap just to show you guys what, was being mentioned. There's a children's one, there's Hope Center ones, lots of other ones with details and contact information. Some of these are also available that we'll be able to prepare for you for an in brochure style, bold, for your outreach. And people can contact, I don't want to take any more time, but people can contact me afterwards if they need more support linking up to how to get these documents either electronically or printed forms.
Beautiful, thank you. Thank you, Laura.
Thank you.
Beautiful.
When there is tabling, I'd just like to suggest that there be QR codes for those items, just because I think a lot of, not everyone, but a lot of people will like, yeah.
There's a card. Just a card with the QR code. They're in my car. I don't have.
Yeah, that can help, yeah,
Yeah.
take people to, because I don't know about
I don't know how to do
how
that
everybody gets information. Oh, I'll show you.
Oh, no, I was
After the
making an
meeting, though.
excuse.
All right. Especially for things like the Friday night market where, you know, people are carrying their things around. Anyway, it's really nice.
Oh, it's a good idea.
Beautiful.
Now I have to learn.
All right, on to reports. I'm so excited we have the DHS director here today. Do you have anything to report to us, Director-elect?
I guess I'll report on the unfinished business and, well, for one, we are working on budgets. I will say we are a small amount of the county general fund, but we also have our own, budgetary issues within DHHS that we are actively working on, and hopefully we'll be able to submit balanced budgets going into the new year. We are, and I don't know that Natalie said this or not, but we are having conversations in the county about reorganization and what that looks like for all of us in the county. And so we'll be working on that and strategies around that. I feel like it's opportunities for us to look more around efficiencies and how we can work together as county departments to do the best for the community. So I actually do feel like this is an opportunity. The other thing that I just like to say that yes, it was just yesterday. We had our first meeting with the architect for the navigation center.
And the crowd goes wild.
And so I don't know if you all know that we started out with a shell of a building, a square footage of a building across from the free meal St. Vincent's dining facility. We hired Hannah Ozanian, who is working with Uplift and others, and actually spends a lot of time at St. Vinny's. We so hired her as a consultant. We did a little bit of outreach around what it would look like if we had a navigation or day center, put together her Hannah's best thoughts, our best thoughts, had meetings internally and such. In a few weeks or a month, I'll get a better timeline of when we can start community programming and, you know, what kind of programs do we want to have there, right? And what it's really gonna look like. So I'm excited. The architect is wonderful and asked really nice program human questions. Just what we would like and anticipate the navigation center being for the population, and so super excited. Eventually we will have you know, different folks. We'll have different committees that we'll come up with to figure out what we're gonna do and how we're gonna do it. And we wanna involve as many of our community members that not only will be service providers, but also, you know, our peers and others that do this work. And I'm excited for Vernon to be a part of that conversation. But also like young people and others, we will be, so I should add, the Navigation Center will focus for, adults 18 and older. And if you are a person with children, we of course would accept and accommodate conversations and refer resources to other areas. Just that we won't want our, kids in the community to hang out in the city. But we're hoping for a safe place for people to be during the day. Super excited. And I think you all have met Hannah in the past and were able to have conversations with her. We've done presentations here in the past. Just when I was about to give up, we are gonna move forward.
All right.
Yay.
She's gonna work with you directly.
She
Maybe the
is,
staff person is what I heard? No.
I'm not gonna say she's gonna be the staff person, but she was the director of the project in Sacramento. And knows a whole lot about, all services and things that could be provided there. She's gonna continue to work for us until the project is up and running, and, if we get lucky enough, maybe she'll hang around and, manage the project or something. I don't know, but it's super exciting. Long time coming.
Yay, that's excellent.
Yeah.
To you, Emmy.
Hey.
The BHD.
I feel like there's so many things I can say today, but I'll try to stay concise. I really appreciate the conversation around educating the community. I think it's so important, and I am so grateful for the work that Laurel has done with me around public facing documents and the intention of this board to really help share information in ways that are useful to the community. And I want to just acknowledge and recognize the public comment around how there are people in the community who still struggle with accessing services or their experience of behavioral health, and that's an element of it too. So it's not that we can just better educate the community, but we also need to be responsive when concerns are lifted up. And so just always welcoming anything that people are bringing forward in terms of places that it's not working, so we can do deeper dives and figure out how to strengthen our system. So thank you for that. I do want to just acknowledge the budget talk. There's so many pieces to that, and the passing of Prop 1 will certainly be kind of shaping how things look for us going forward. We have till 2026, and that feels like that's tomorrow. And so we need to very quickly be working on how we'll pivot given that. We're also internally, I think some of you may know this, but with all of the changes with CalAIM, one of the other things that we've been faced with is bringing on board a new electronic health record, and also implementing payment reform. And so we're internally really working hard to make those things work in ways that keep us fiscally solvent. It has not been easy. And so we just had a meeting yesterday with many different members across our system that we really need to kind of leverage as resources to help us do billing and be able to get a cash flow that's going to support behavioral health services going forward. It's been really challenging, and it's so important for us to do this work, and we have mandated services that we're required to do, and we want to do other things that are important for the community, and it just gets challenging sometimes to balance those things. So,
and I was so proud of all staff being so leaned into the conversation and just, willing to do the extra things that have to be done in order for us to move forward. So
yeah, for sure. Yep, it was really nice to feel the support within DHHS across programs and systems. So that was really incredible. I wanted to just mention we a little while back, we took to the Board of Supervisors a resolution around joint conference committee that just changes our structure a little bit around oversight of sempervirens. And it's important because there are some places that the state and the feds are asking us to kind of shore up our structure and how we do that work. And so that was on the Board of Supervisors agenda. And as part of that, we're adopting some new bylaws for the governing body for sempervirens. And we're also identifying an interim medical director, because as many of you know, that position has been outstanding for quite some time. And so we've been able to find somebody through our contract provider, TBH, who's going to step into that role. And I'm super grateful about that, because that's going to make a big difference. And it's interim while we're working on a longer term solution, but we do have somebody now temporarily. So I'm really glad about that, to say it to this group. The crisis residential treatment facility is getting very close to opening. I think they're looking at doing kind of an event towards the end of May, and that will be before we think we can open at the beginning of June. Like those are, it's looking really hopeful that beginning of June we'll actually be able to have
Good job,
services
Jack. Good job.
provided.
Good job.
Yep.
Good job.
Yep. Jack has worked really hard on this for quite a long time. So that's been wonderful. And Senator McGuire has supported this. So it's really nice to have this support. The only other thing I wanted to say, just because it seems important and it makes me happy, I was at Lobby Day last week with California Behavioral Health Directors Association in Sacramento. And so I got to meet with Senator McGuire's office, and also Assemblymember Wood, and I always appreciate that because they're very supportive. But CBHDA is bringing forward a couple of bills that I really like, AB 2995 and AB 2119. The numbers maybe are less important, but you can look them up. But they're both related to stigma, and I just appreciate it so much. They're both about cleaning up language in the code and in other places that are stigmatizing. And one is specific to substance use disorders and trying to just address how there is some language in there that's pretty awful. Like there's some language that's still used around people that struggle with substance use issues that is pretty pathologizing. And same for mental health. So stigmatizing mental health language cleanup is 2119. And it's really about, instead of saying, you know, severely mentally ill people, saying an individual who is struggling with mental illness, like just changing the language so that we can be better at supporting individuals in our community who are often people that are loved ones of ours, or us that are struggling in any of these areas. So wanted to flag those two bills for this group. That's it.
Thank you.
Will those be in the minutes so that we can, sometimes I don't remember those numbers.
Did you want to write it down? Oh,
I
you
can't.
I'm not that fast.
Joe can include it in the minutes. Yep.
I know Jill's big.
The medical director, I mean, is that a psychiatrist?
Yep, yeah. Kiana Griffith is her name, and she's been on staff with us for a while through TBH.
Oh, yes,
Yeah.
Dr. Griffith.
Yeah, and so she's gonna be interim medical director, which is
Okay.
wonderful. I'm really glad about that.
I have a question for our Director of Mental Health. We have an interim patient's rights advocate at the moment.
Yeah.
Is there a future, can you give me an update or us an update of what it looks like, of how long it will be before we get a permanent?
We're interviewing.
Okay,
and
cool.
so I hope it won't be a super long time.
Okay,
Yeah.
Thank you.
AOT update.
Yeah, AOT, Connie mentioned obviously, you know, just some stuff with the budget, right? But programmatically, I think it continues to go well, and we accepted a couple, or EA, I should say, accepted a couple new referrals the other day. So we've had a couple clients, as I mentioned, graduate, and then some that they go and get in justice involved, I would guess, and then some of their dispositioners are going to the state hospital, so when that happens, AOT would step out, EA would step out, and so that, you know, certainly is an outcome that we would hope to avoid, but that's happened a couple times here recently where we've had to send the folks to the state hospital, so, you know, overall, I think it's a really good program. I think we know from our work with CCT, these intensive outpatient case management programs, you know, where you have staff, therapists, and, you know, that are right there to help you when you need them, more or less, you know, are really effective. So I think the EA is doing good work. One thing I'll say about the crisis residential too, you know, just as it's on my mind, had a meeting with the public guardian's office, and they were telling me, public guardian was telling me they had 6 people in long-term care placements that were going into crisis and needed to go to SV, like all at once this week, 6 people. And so they were coordinating with SV on this, and I was like, there's no room, but as you know, and I'm just really excited about, not that those folks would necessarily end up at the crisis residential, but there's just that trickle down, right? So SV is able to discharge people in a timely manner, and we're able to just have capacity here locally. So, yeah, it's just a really needed thing, I think. So, I'm getting excited for that.
Good job.
A quick question. When you say they graduate the AOT program, I think I know what that means, but what does that mean?
So we've had one person that's, I think, kind of graduated where they, you know, were in EA, or I'm sorry, they were in the AOT program. They received services from EA. We never had to go to court with them because they were always kind of willing to participate with EA. And so EA then would say, okay, after about a year or so of stability, and then the client kind of preference, right? That, yeah, I don't think I need this level of service anymore, that they would graduate, and then they're certainly, they're referred on to county behavioral health for sort of ongoing treatment, right?
Were you asking if there's an actual graduation and what that process
No.
is? You were just asking what the process is for them to get to a graduation.
Evaluating, you know,
Yeah.
and that sounds that kind of the criteria that just fits the program.
Yeah, I don't think there's anything in statute about it, but I think internally we've said, hey, about a year of stability, engagement, no SV trips, no jail trips, you know, that seemed about, and this person's obviously kind of from the get-go that was pretty motivated.
So that opens up another slot.
That would open up a slot.
And you were at one time gonna have some people from Nevada County.
Yeah, so we're still working on that. I've gotten ghosted a little bit by Nevada County, so.
I'm not giving you help.
Okay, I will.
I would be happy, because I was really looking forward to hearing the county that's been doing AOT the longest, the beginning of it.
Yeah,
Love
I'll
to-
work to.
Awesome. And I just want to say from where I work, that it's been nice having AOT, because it's just like another thing, like, oh, you're an AOT client, like, we can have somebody else come and help. So that's, overall, I think it's been really good for our county, and yay, us. Sorry.
It's true.
I know, we've got a lot of stuff. And Teresa Comstock from Cal BHP is gonna come to our May meeting, and so I'm super excited about that. All right, next is SUD committee update. We have Marguerite, yay.
Okay, so I unofficially ran it again under the auspices of Laura. And we had asked everybody at the meeting before to please update us at this meeting, and they did, about what had happened since the pandemic and since the committee had kind of like dissolved in a way. So everybody came back and kind of reported on where things had left off, and that was good. And then we moved on to what kind of common area are we all experiencing that would be good for us to have some focus on. And it turned out that people were talking a lot about what happens in their programs when people, either because they didn't realize that they had fallen off of Medi-Cal, or because they had been in the jail and then released, having been advised to re-up their Medi-Cal, that a lot of SUD agencies that people work with in our county are both losing a lot of money and or losing a lot of time to having to kind of hustle around. So it was everything from the TAY people saying that, yeah, this happens to us in TAY, to, which was more about mental health, but also drug Medi-Cal. And then the ages people were talking about sometimes it taking up to 3 months to get people totally back on Medi-Cal when they'd, had fallen off. So we pretty much decided, and other agencies said the same thing, like, yeah, we have people and all of a sudden they don't have Medi-Cal anymore, and we're, kind of footing the bill ourselves, or asking people who probably can't pay to pay. And nobody, I was really kind of proud of everybody. Sounds like nobody starts refusing treatment right away when that happens. Nobody says, oh, you can't have your methadone or Suboxone anymore. They work with them, and or no, you're in the middle of residential treatment and you're off of that. No, let's get you back on. They don't kick you out of the program, but it does cost both time and money. So we decided as a committee that by this next meeting, we would bring any resources we had or any thoughts we had, the next meeting being April 11th, to that meeting. My assignment, or I gave it to myself, was to talk to a nurse I know at the jail, who later talked to Laura, I think, from what Laura told me, about how the jail handles it now and maybe what kind of improvements could be made there. So I think our first project in the SUD committee will be to see what we can do about helping people who have fallen off Medi-Cal, or getting some kind of solution, a better solution in place about staying on drug Medi-Cal and or Medi-Cal when they've been in jail or they've fallen off. So that's a starting thing. In future meetings, we will be talking, once we have more information, about the Prop 1 and other legislative things that are happening right now or have happened that have big implications for SUD treatment, including the whole robbing Peter to pay Paul concept that we've talked about in this committee, that, SUD's got to be somehow included now in 5150s and put somewhere, and all that doesn't exist anywhere in California. So we will be addressing some of that in later meetings, but we're starting with this Medi-Cal and drug Medi-Cal thing and seeing what we can do. I think probably Connie knows whoever I could talk to in DHHS in the Medi-Cal unit about how that could be sped up, or if it could be sped up in some kind of useful way. So that's what we've done.
Thank you. Cool.
Marguerite, I'm glad you're working with somebody, a nurse in a jail. Is that on the behavioral health side or is that on the WellPath side, do you know?
Well, I'm not really working with him. It's somebody I happen to know, like the rest of you work. I'm retired. So when I get somebody that in any venue I'm in, and I find out that they work for the county, then I start talking to them. But this is, this is Bob Urey. He happens to have been in the McKinleyville Community Choir, which I belong to, and was one of our accompanists in a quartet that I put together. So anyway, Bob and I have become friends, kind of, and I called him and asked him what happens at the jail, and it is on the health side that he works. But he gave me a couple of numbers of people to call in the more service-oriented parts. And I just had a medical procedure yesterday, which is why I'm online and not there in person. So I'm supposed to be good and rest for 2 days. So tomorrow I'm going to call the 2 people that he gave me names for.
Yeah, I'm glad you're doing that. And, you know, you could also reach out to me. There's a lot happening on the justice front with regards to Medi-Cal, and there's a Justice Involved in Reach program. There's a lot happening right now around that to try to make sure that the Medi-Cal stays on for 90 days pre-release, so that there's that smooth linkage to, you know, services once they're released. So feel free to reach out to me too.
Who's talking? Because I can't see you.
Oh, it's Paul.
Paul McNacky.
Oh, Paul, thank you. Yes, I will reach out to you.
Handsome one over there.
Oh.
Thank you. So that's it. Except that we still need a permanent chair to that committee. And I don't want it to be me right away, but Laura, if you want me to do it one more month, I can.
I think I need you to, if you would. I'd be very grateful. Thank you.
Thank you.
All right. Great, good update. So that's the only committee that we have fully functioning at this time. So with that, we'll go to Vice Chair. Do you have any reports?
No, nothing more than.
Okay, great. I'm just.
I sure like you. Our brains sometimes go the same weird track.
That's it? Really? I was teasing.
Oh, okay. No, I want to keep thinking about the Speakers Bureau, and that's something on my mind. And I think the stigma language would be a great way to do a presentation if I would, for instance, go into Kiwanis or something like that, because that kind of language is just hard to stop. And so I want to get more information about those recommended changes. So thanks.
One of the things that Emmy brought to our retreat was this implementation underway, just the few little things that are, that you have to oversee or deal with, which is mind-boggling to me that he only has to do this, but I'm so happy to hear about an interim medical director who's, is that like out in the world?
I think, yeah, we can say that out loud, right? It's just like yesterday and today.
Okay.
We haven't actually officially approved her, but everybody's in agreement.
Okay, well, as soon as I can educate some people who are constantly hammering on that, I would love to get that out.
Yeah, okay.
I wanted to, I worked for the police department, and Commander LaFrance did a educational series on ASD 5150 and SB 43, and I want to thank Paul. He did a great job, and I recorded him, and I have that recording for you if you'd like. No?
Yeah, no, I experienced that myself, so I don't need to revisit that.
Well,
Thank you, though.
it's a good educational tool.
That's true.
If
Thank you.
somebody wants.
I'll send it to my mom. She'll appreciate that.
Well, okay. All right, smart Alex.
Was that the one on 5150s?
It was ASD, Autism Spectrum Disorder 5150 and SB 43, yes.
Gotcha.
You were, did you come? No.
I got the flyer. I shared the flyer with
Thank
people.
you, that's great. So we
I'm
have.
sorry that I couldn't come.
We had a lot of people, I think we had about 140 people go to 4 of those things, and I'm sure there were 500 more that could have come, and that we will continue to try to educate, so I love to educate. Other than that, I think I already mentioned mental health month. I always think of all these things I want to say, and then And I forget my pieces of paper. Laurel, I have the letter. All right, future unfinished business. We heard about NAV Center, Care Court. Anything new?
Oh, you have a hand and maybe Sharon could say.
Alyssa.
I found those notes.
Oh.
It was in fact 19 items. We identified 19 goals. And if you want me to, I'll read them all again.
You're gonna put together some written minutes, right? And that will be in there?
We had not talked about that, but if you'd like me to, sure. Yeah, absolutely.
That would be helpful.
Okay.
Let's see it in writing since I'm a visual learner.
Okay.
Got
it.
Thank you, Alyssa. Care Court, you said that.
I'm wondering if Sharon has any information.
Sharon, do you have any info on Care Court?
Well, a little bit, sure. We had a rural affinity work group that was convened, I believe it was yesterday. The week is going by quickly, but it was by the technical assistance group that's helping all the counties establish their care courts. And it was one of the better sessions I've ever been to because it was actually a back and forth conversation rather than more of a presentation. So that was very helpful. We didn't get to a lot of answers, but a lot of questions have been identified, which is good. They've shared the resources that they have with us, which are publicly available. And I would be happy to send out the notes that I have for some of these links if anyone would like to take a look at them. But what I'm hoping for is this working group is just the first meeting of an ongoing group where we really are talking about the nuts and the bolts of the implementation, and it's, across the sectors, the court, the behavioral health, everybody. So that was very valuable. We've got the conversations continuing with our court, with our cross collaboration. So those conversations are ongoing, which is good. And it already puts us ahead of other small counties that we have those meetings going on now. So we're doing good at the moment. We'll bring you updates as we have.
Thank you.
Yay. Thanks. All right, future items. Vernon.
Vernon Price, I'd like to re-entertain the thought of behavioral health bridge housing. Getting a presentation or some communication on that, because I believe if I'm reading correctly, on 12/12/2023, the county received the first $1.1 million in the first of 3 years. So, I mean, we're looking at some good stuff here. I just would like to see where all of this is going to be implemented.
I will have Aaron or Robert come and present. Can we do that next time?
For April, yeah, May we're full.
Yeah.
For April, what's the date in April? And I'm gonna text them or I'm just gonna email them right now and ask.
The 25th.
You guys are on a roll today.
Well, let's aim for it. We have an executive maybe next week. Then we can.
I won't be there.
I'm gonna ask you a personal question, but I don't.
Thank you.
And Laura, Supervisor Madrone will be here next month instead of me. Sorry.
You'll send us your questions with him?
I'll send my questions with him.
Okay. Does anybody else have any future items? Okay. So other than that, bridge housing, I have Tay.
What's the date for the next meeting?
25th, April 25th.
Can I talk?
Is that an item, Eric? What's
It's an item you want to put on the meeting.
I don't have any other items. I just wanted to make a quick comment about what I'm seeing today and relating to the 10 years that I've been on the board. It's very, very encouraging to see my particular field is outreach, and it's the type of thing where everybody can benefit by knowing that our community here is reaching out on the streets and fanning out throughout the town and helping people where they're at. And the happiness is spread to the clients as well, because they don't have to go through that crisis period before they ever get invited to mental health. Things like phone outreach, that kind of stuff. It's all great, and I have to say it's one of the better meetings I've been in quite a while.
Thanks, Eric. That's awesome. All right, well, anything else for the good of the order? Nope. I adjourn this meeting at 13:58. Woo!
I will go get some brochures.
Thank you, everybody.
Thank you.
Steve already knows